Okay, so we're going to call the meeting to order now. This meeting of the Personnel Policy, Labor, Employee Relations Committee of the Board of Health. Let's see here. I'm going to flip through the agenda and the recommendations. First thing we have to do is approve the agenda. Oh, now my system's not working. Oh, of course. Text later. I better just go straight to the recommendation because I tried to pull up the agenda and that's giving me a hard time. So let's see here. Moved by Jamie, seconded by Nancy. Be it resolved that I'll just go with PPLER committee agenda for September 28th, 2022 be approved. Now we've got to go through and do a verbal vote. I'm just going to go off this list here. There should be, what, 5 of us, 6 including me, right? Blair?
Yes.
Gary?
Yes.
Jamie?
Yes.
Marianne?
Yes.
And Nancy?
Yes.
Okay, I also approve. So now we've got that part done. Oh, here we go. Now my agenda pulled up. So I guess conflict of interest. If anybody has any conflicts of interest to declare, they can do so now or at the time the item comes up, I guess. Does anybody have any conflicts to declare? Hearing and seeing none, I'm going to move forward. Item number 4 is the approval of the previous minutes. So we got a couple of those, right? Let's see here. The next one is moved by Gary, seconded by Marianne. Be it resolved that the minutes from the PPLER Relations Committee held on May 25th, 2022 be approved as presented. Any corrections, comments on the minutes? Seeing none, we'll go to the vote. Blair?
Yes.
Gary?
Yes.
Jamie?
Yes.
Nancy?
Yes.
Marianne?
Yes.
All right, and then we have more minutes, right? Next one. This is from the in-camera session on May 25th. So moved by Nancy, seconded by Gary. Be it resolved that the minutes from the PPLER committee in-camera meeting held on May 25th, 2022 be approved as presented. I guess comments, corrections. I don't even know if you can do that because it's in camera, but we'll go to the vote. Blair?
Yes.
Gary?
Yes.
Jamie?
Yes.
Nancy?
Yes.
Marianne?
Yes.
Okay. Let's see here. Back to the agenda. We approved all the minutes. Date of the next meeting is going to be at the call of the chair. Time to be determined. Location to be determined. Item number 6 is business arising. I don't think, is there anything under business arising? No.
No.
Nothing. So then we have to go into closed session, go in camera to deal with labor relations or employee negotiations. So we have a motion for that, right? Let's see here. This one is moved by Marianne, seconded by Jamie. Now therefore be it resolved that the PPLER committee move in camera at 5:28 p.m. to discuss items.
Okay, we're live.
Okay, thanks. So we're all done on our closed session. We're going to rise and report. So this is moved by Gary, seconded by Marianne. Now therefore be it resolved that the PPL, oh, I'm hearing something. I'm good? Everybody can hear me?
Yep.
Now therefore be resolved that the PPLER committee rise and report at 5:52 PM. Okay, go to the vote. Blair,
Yes.
Gary,
yes,
Jamie,
Yes.
Nancy,
Yes.
Marianne.
Yes.
Okay, now let's see, where do I go now? Okay, so now I have to read out these motions from our in-camera session, right, Sherry?
Yes.
Okay, so give me 1 second here. This is moved by Jamie and seconded by Nancy. Whereas the current Ontario Nurses Association collective agreement expired on March 31st, 2022. And whereas negotiations were held with ONA on September 7th, 8th, 14th, and 16th, 2022. Now therefore be it resolved that the PPLER committee recommend that the Board of Health approve the monetary changes to the collective agreement between the North Bay Parry Sound District Health and ONA for full-time and part-time employees effective April 1st, 2022 to March 31st, 2025. Okay, going to the vote. Marianne,
Yes.
Nancy,
Yes.
Jamie,
Yes.
Gary,
yes,
Blair.
Yes.
And I also agree. That is carried. We have one other motion coming from our in-camera session. This one is moved by Gary and seconded by Marianne. Whereas the current management non-union employee policy expired on March 31st, 2022, and whereas discussions were held with MNU representatives on August 31st, 2022, September 12th, and 22nd, 2022. Now therefore be it resolved that the PPLER committee recommend that the Board of Health approve the monetary changes to the MNU employment policy between the North Bay Parry Sound District Health Unit, full-time and part-time MNU employees effective April 1st, 2022 to March 31st, 2025. Questions, comments? I guess I should ask those before we go to the vote. Seeing none. Go to the vote. Marianne,
Yes.
Nancy,
Yes.
Jamie,
Yes.
Gary,
yes,
Blair.
Yes.
Oh, I can hear my family coming through the door right now. Excuse the background noise if you can hear any. Okay, so that finishes up our in-camera session. We passed our motions into resolutions. Anything under new business? Does anybody have anything for new business? No new business. Number 9 is adjournment. We don't have a motion for that though, right? I can just adjourn. I have the authority as chair. No? We do need a motion? We don't need
No.
one. All right, then as chair, I officially adjourn this meeting of the PPLER committee. Thanks everybody for your help and work. And I guess we'll go right into the next one, right?
Thank you. Okay, next is finance and property.
Okay, that's me again, right?
Yes, sir.
Let me see here. I'm just going to grab those ones.
Yeah.
Oh, is there someone behind me? All right, let's see here.
I'm working tomorrow.
All right. Here we go. Well, I thought I had it. Okay, so I'm going to call to order this meeting of the Finance and Property Committee for the North Bay Parry Sound District Health Unit. Item number 1 is called to order, which I've done. Item number 2 is approval of the agenda. And I've got a motion here, moved by Jamie and seconded by Nancy. Be it resolved that the Finance and Property Committee agenda dated September 28, 22 be approved. Any comments, amendments to the agenda? Okay, seeing none, we will go to the vote. Blair,
Yes.
Gary,
Yes.
Jamie,
Yes.
Nancy,
Yes.
Marianne.
Yes.
All right. Let's see, what is next here? We have minutes now. Oh wait, conflict of interest. Does anybody have any conflict of interest to declare? Do so now or at the time the item comes up. I don't see anybody with any conflicts. Moving on. Approval of the minutes. So previous minutes, we have minutes from our meeting on June 22nd. This is moved by Gary, seconded by Marianne. Be it resolved that the minutes from the Finance and Property Committee meeting held on June 22nd, 2022 be approved as presented. Any comments, corrections on the minutes? Seeing none, we'll go to the vote. Blair,
Yes.
Gary,
Yes.
Jamie,
Yes.
Nancy,
Yes.
Marianne.
Yes.
Okay. Previous minutes adopted. Now, let's see, we have to, date of the next meeting to be determined, time to be determined, location to be determined. Business arising, item 6.1, AMO delegation update. Who wants to take that? Anybody? It's on the agenda, no? That, who's supposed to speak to the AMO delegation? Jamie? Oh, my bad, didn't see you there. Go ahead, Jamie.
Okay. No, that's okay. I wasn't able to actually go to the delegation, but I had to make a speech shortly after that to the delegates. So it was impossible for me to go from the timing of the delegation with the minister to do what I had to do for AMO. So, but it seemed as though later on that the ministry was making some concessions for public health units, cost-wise. So I think they must have heard from something. Now, are they enough? I don't think so. But given how they've been over the last few years, I think it was at least something our way. If I'm trying to remember, there was money, I believe, for dental. Maybe Ms. Isabel, do you remember what all they made some concessions on? Because I know the minister did make a couple.
In the statement she made, it was to do with mitigation funding is going to continue for 2023. And I did hear at the conference I was at last week that it's going to continue at the same rate that we were previously funded, which I was also worried about that. So that's good.
That's good. Yeah.
And the second item was that COVID funding will continue into next year. We've had no confirmation of amounts or for exactly what yet, whether there's going to be any change in criteria to receive it, but there is supposed to be COVID funding again in 2023. So those are the two things that were mentioned in her press release.
Yeah. Okay. All right. Okay. I was trying to remember what it was, but that was at least something, that some stability at least in what they were doing. I mean, there's still a lot of clarification as to where they're heading with public health and that sort of thing, which is really, really quite sad that they're not saying more than what they are. But yeah, no, the timing for me was for the delegation was just not good at all. And I was scheduled to speak like 15 minutes after the delegation was done, so there was no way I could get from the one place to the other and be there and then deal with what I had to deal with backstage. So it's unfortunate, but anyway, I'm sure Tanya did well and you know, made our points. So yeah.
Thanks, Jamie. Good to hear about ongoing mitigation funding. Although doesn't it seem weird that you change the funding model and then just give mitigation funding forever after that? Like, I mean, I'm glad we're getting the mitigation funding, so I shouldn't complain, I guess. But good to hear.
I imagine their strategy is look, we can give mitigation funding, and then if we decide we don't want to give mitigation funding then we got to scramble, because they'll probably tell us at 4 o'clock on a Friday afternoon when you know, they're not going to do something, and then we have to scramble to you know, get that money. So
I expected that shoe to drop at some point over this term, but it never really did. So on to the next term.
I think what we need to do is you know, probably the next term of council, okay, formulate a resolution that asks for future clarification as to, you know, how their funding model is going to be approached. And, you know, we preface that with, you know, how, you know, public health has really stepped up during this pandemic and, you know, been there for the people. And without it, it would have been a nightmare. So I think, you know, we just lay low till after the election, a municipal election, and then, you know, start asking the questions and make sure that AMO is involved with it, because now Monica has retired. Monica was a huge advocate, Monica Turner, a huge advocate for, you know, public health and healthcare in general. And I don't think they've finalized who's taking her place yet for director of policy. So, you know, that will give them some time or whatever to pull that person through as well. So, yeah.
AMO did come out with a statement on public health that they put forward to the ministry as well, I believe. So,
yeah, that's right. Anyway, we got to keep at them.
Okay, thanks, Jamie. Isabel, any other questions, comments about AMO delegation for Jamie, for Isabel?
No.
Tanya's not here. But, Nancy, yep, go ahead, Nancy.
I'd like to thank Tanya for taking it forward. And I think Dan was there to back her up. I think he was planning on going. And Isabel actually helped, and so did Dr. Zimbalati, help prepare the presentation. So thanks to the teamwork that went behind that.
Okay, thanks for that, Nancy. Let's see here. Moving on down the line on the agenda. Talked about AMO. Next item is 7.0, new business, and it looks like there's a couple items there. 7.1, second quarter financial statements. Does anybody want to speak to that? Isabel, I guess.
Yeah, so these are the usual statements I prepare. It's for the half year at the end of June. And at that point, we're showing underspending still in a number of places. We had a number of unfilled positions, and we had the first quarter of the year especially, there were a number of people deployed from their regular work to do COVID work. So we're whatever unexpended dollars we have from mandatory programs is being applied to COVID, and then they're funding the difference. Our forecasts for the end of the year which is the last page of this document, show that there may be money returned, the one-time funding at this point, but we'll see. There's how immunization work goes over the next few months, and that'll help us to. This was a forecast that we made in the midsummer, so it may or may not be accurate at this point. So we do have to do, the next forecast is due at the end of October, so we'll see a little more accurately at that point whether how much money will be returned from the COVID money. Anyway, so far so good, and we've made allowances all the way along for the negotiation and the retro pays and so on. So I think those are all accounted for in here. So, or some of them were anyway at that point. They've changed a little bit over time here, but yeah, most of it's already accounted for in here.
Okay, thanks, Isabel. Questions for Isabel or comments on the financial statements? Seeing none, I guess we don't have anything to pass on that one, right? We are just getting an update. And I guess we have MOH expenses as well, second quarter MOH expenses. Did you want to speak to that, Isabel?
They're pretty obvious what they're for, and there's not a whole lot of them there, so I'll just leave it as it is.
Okay, anybody have questions or comments about MOH expenses? Seeing none, okay, thanks for that update. And now we are going into closed session. So we have got motion here to go into closed session. This is moved by Nancy, seconded by Gary. I'm probably gonna have to move here. I got people running around behind me. We're about to go into closed session. That's not good. I'm just gonna move into a different room. Just give me one quick second, folks.
There's a motion for those.
Yeah, there's a motion.
Yeah, there's a motion to go in camera.
No,
No, for the
before that,
statement.
you missed the motion for
Statement.
approving the second quarter financial statements.
No,
and
there's no
No,
motion.
no motion.
Okay.
Why is it down there? On my agenda.
Okay, I just moved into,
Oh,
so we're good? Nope, I didn't miss one.
sorry.
We didn't have any motions for item 7?
No, sorry.
Okay, all good. So this is moved by Nancy, seconded by Gary. Be resolved that the Finance and Property Committee move in camera at 6:09 p.m. to discuss agenda item 8.1, a trade secret or scientific, commercial, financial, or labor relations information supplied in confidence to the board, which if disclosed could reasonably be expected to prejudice significantly the competitive position or interfere significantly with contractual or other negotiations of a person, group, or persons or organization. Anybody want to comment on us going into closed session? Seeing none, we'll go to the vote. Blair?
Yes.
We are live.
Okay, so just finished up our closed session. We're back in open session. We're going to rise and report. So moved by Marianne, seconded by Jamie. Be it resolved that the Finance and Property Committee rise and report at 6:24 p.m. No comments or questions on that. Going to the vote. Blair,
Yes.
Gary,
Yes.
Nancy,
Yes?
Jamie,
Yes.
Marianne.
Yes.
All right, so we are ready to pass the motion coming out of our closed session. So this is moved by Marianne and seconded by Jamie. Whereas the lease for the Perry Sound branch office location that has been serving clients since 2006 expires August 31st, 2023. And whereas the existing location is dated and no longer meets the current requirements, including the expansion of dental services. And whereas the search for an alternate location conducted in consultation with real estate firms, community partners, and with input from others resulted in successfully finding a suitable site. And whereas upon approval from the executive team, a Perry Sound Programs and Services Collaborative Working Group was tasked to work on preliminary space design and lease costs for this location to provide programs and services in the community. Therefore, be it resolved that the Finance and Property Committee recommends that the Board of Health for North Bay Perry Sound District Health Unit negotiate with the landlord of the proposed facility to finalize the design to lease for occupancy effect. Questions, comments about that before we move to the vote? Not seeing any. And so we'll go to the vote. Gary?
Yes.
Blair?
Yes.
Nancy?
Yes.
Jamie?
Yes.
Marianne?
Yes.
And I support as well, so that is carried. All right, let's go to the agenda. Feel like that's close to the end, right? If I go to the top here, probably just adjournment, right? Oh yes, so just adjournment. And thank you very much for your help, everybody. I hereby adjourn this meeting of the Finance and Property Committee of the Board of Health. And hand it over to Nancy.
Thank you very much, Scott. I'm going to ask just so I can see, I don't know, where do I just push so I can see the people on the screen? I've got my agenda up, but I'm not seeing them. Do you know off the top of your
Up
head?
at the top of your Teams where it says people, it'll show you the list of people down the side. Are you not seeing?
No, I don't have.
Oh,
Yeah.
so tab at the bottom, the little T, the purple T at
Yeah.
the very bottom.
Yeah.
If you click, hover over that, you'll probably see the screen with the people.
I
on it.
do.
Okay.
Good night,
There you
everyone.
go. Good night, Isabel.
The other
night.
thing you can do,
I got everybody up, and I'm going to do that just
the other thing you can do to,
split screen.
well, you can open up your agenda and then open up your Teams.
Yeah.
So you can see everybody and then just minimize it. And you'll,
Oh,
it should,
I've got my agenda here. I've got the whole package in front of
You
me.
got it
so
all ready.
I
okay.
think I do. That I can, or I can pull it up. I've got them both here, so that works. Okay, thank you very much. I knew I found everybody at one point and then I lost you all again. So anyway, so welcome everyone. I'd like to call us to order at 6:28. And we go on to number 2 item on our agenda, and that's the approval of the agenda. And it's been duly moved by Scott and seconded by Jamie. Be it resolved that the Board of Health agenda dated September 28th, 2022 be approved. Is there any discussion or any amendments to that? Seeing none, well then I'll carry the vote. I'll call the vote. Scott?
Yes.
Great. Blair?
Yes.
Marianne?
Yes.
Jamie,
Yes?
Gary.
Yes.
Great. And with that, it's carried. Okay, I just make sure that I tick everyone's name off here. Okay. On to the next item. Conflict of interest, number 3. If anyone has any conflict of interest on any of the topics that we have today, please feel free to declare them now, if anyone has any, or during the rest of the meeting. Seeing none, we can move on to the next one. Point 4, approval of the previous minutes. We had a board meeting in June. I'm just going to move over to this. And we do have a motion here, if I can get there. We have a motion that's moved by Jamie. We have a little technical issue here. Sorry. There it is. I jumped ahead too far. Okay, here that we have a motion that is moved by Gary and seconded by Mary Ann. Be it resolved that the minutes from the Board of Health meeting held on June 22nd, 2022 be approved as presented. Are there any amendments, changes, any discussion regarding those minutes? Seeing none, then we'll call the vote. Blair?
Yes.
Gary?
Yes.
Jamie?
Yes?
Scott?
Yes.
And Mary Ann?
Yes.
With that, the motion's carried. Okay. Now, we also have we had a Board of Health in-camera minute meeting on June 22nd, and with that, I also have a motion for that, and I'm just pulling that forward. Pardon me. A little slow here. Working from the paper copy, too. There we go. So we have a motion here that's moved by Jamie and that's seconded by Gary. Be it resolved that the minutes from the Board of Health and Camera meeting held on June 22nd, 2022 be approved as presented. Is there any discussion or were there any amendments that anyone would like to make with those minutes? Seeing none, we can call the vote. Blair?
Yes.
Gary?
Yes.
Jamie?
Yes?
Scott?
Yes.
Mary Ann?
Yes.
With that, the motion is carried. Okay. The date of the next meeting, which is our item number 5, is to be determined. Date, time, and place. So next, we're on to business arising. Did we have any business arising from that anyone would like to bring forward from our meeting from June? Seeing none, then we'll move on to item number 7, which is a report of the Medical Officer of Health. Dr. Chirko, the floor is yours.
Thank you very much. So last week, when I compiled the MOH update, which you have, I reported that there's been a gradual decrease over the last 7 to 8 weeks of all the relevant COVID-19 indices, both provincially and within our health unit district. And as we've experienced throughout the pandemic, things can change quickly, and today is no exception. As anticipated for the fall, an upward trend has begun. The province is now reporting the following changes over the last 2 weeks. The 7-day average of cases has increased by about 12%. The 7-day average of percent positivity, which is 12.5% in the province, has increased by 4%. Hospitalizations have increased by 4%. ICU admissions as well increased by 12%. And fortunately, the 7-day average of deaths has decreased by 18%, which is very encouraging. The BA.5 Omicron variant continues to be dominant in Ontario. And over the last 2 weeks, our district is experiencing the following. We've had an increase in a case rate per 100,000 by 87%. We've gone from about 58 to 108 cases per 100,000, whereas Ontario is about 50 to 55. per 100,000. Our percent positivity also has increased by about 47%. And we are also seeing an increase in the outbreaks over the last 2 weeks from 1 to 8 confirmed and 3 suspect. And those are primarily in long-term care home and retirement homes. Currently, 22 individuals are in hospital with COVID-19. 2 are there due to the virus. COVID-19 related critical illness is still low with 2 admissions to the ICU, and no deaths have been reported in the last 2 weeks. So as the fall progresses, more cases are anticipated both provincially and locally, and how quickly this will occur, how significant the rise in cases and the severity of the illness will be, and their impact on the healthcare system really remains unknown. The public can certainly help to lessen the impact this fall by doing some of the following, if not all. Being vaccinated with the primary series or booster doses when eligible. Vaccines continue to offer really good protection in preventing severe disease, hospitalizations, and death. We're also advocating that people to stay home and away from school if you are sick until you have no fever and your symptoms are improving for at least 24 hours or 48 hours if it's gastrointestinal symptoms. And after isolating, wear a mask when out in public for 10 days from when your symptoms started. And it's also very important to, if you have these symptoms, to avoid non-essential visits to vulnerable individuals, as well as highest risk settings such as hospitals, long-term care, retirement homes, for 10 days when your symptoms first started. And really follow this advice, whether you've tested for COVID or not. And also, you can make sure that if you're eligible for COVID treatment, and how to get tested and access treatment if you are eligible. Now, before I turn it over to Dr. Zimbalati, our recently appointed Associate Medical Officer of Health, and congratulations, I'll give you a brief update on influenza. Ontario is experiencing low interseasonal sporadic influenza activity, and locally we are reporting no influenza activity for week 4, and that's from September 18th to the 24th. And since the beginning of the season, there's been just 1 case of influenza A. Now, the Southern Hemisphere usually does predict what we might experience, but not always. They had an early onset and the harshest influenza season in the past 5 years. And the data pertaining to whether or not there was a good vaccine matched to the circulating influenza strain is not available at this time. So it is anticipated that influenza vaccines are going to be available shortly, and we'll start off with the high-risk groups, followed thereafter by the general population. And plans are in place, and every effort really is being made to administer the influenza vaccine with those eligible for COVID vaccines. So now I'll turn it over to Dr. Zimbalati to provide an update on the vaccination program.
Thanks, Dr. Sherko. The bivalent vaccine became available in Ontario on September 12th. In the first 2 weeks of the bivalent rollout, 1,127 COVID-19 vaccine doses were administered in Nipissing and Parry Sound districts. About 85% of those were for the bivalent vaccine, and most of the remainder being COVID vaccines for individuals under the age of 18. So far for this week's Health Unit run clinics, booked appointments number over 900. We have been able to keep up with demand and are adding appointments by either adding vaccinators or extending the hours of the clinic, if most of the appointments are booked a day or more in advance of the planned clinic. In addition to the Health Unit run clinics, about 15 pharmacies across Nipissing and Parry Sound carry vaccines. And to date, the Health Unit has distributed about 600 doses of bivalent vaccine to community partners in our area, including hospitals, long-term care homes, and pharmacies. Individuals 18 plus and immunocompromised individuals aged 12 to 17 who have completed a primary series are now eligible for a bivalent booster. In general, our messaging around the bivalent vaccine is, if it has been more than 6 months since your last dose or COVID infection, your protection against severe illness may need a boost. People at higher risk of severe illness from COVID may be better protected if they come forward as soon as they are eligible for a booster, which is 84 days after infection or last dose. And the bivalent vaccine, which is more Omicron specific, will likely provide more protection as a booster than the original vaccine as a booster dose. And that's all I have, so I'll pass it back to you, Dr. Chair.
Thank you. So do you have any questions, be happy to take them now. Jamie? I'm sorry, Matt.
No, go ahead. Sorry, Jamie.
That's okay. I imagine that the numbers are probably actually a lot higher than what it, because people are doing
Correct.
rapid tests and they're just isolating or not doing anything. And I know that it's greater than what's being reported. So yeah, I will say I ended up with it in August after the AMO conference. But anyway, I had the 4 shots and I had a bit of a raspy throat. So, but otherwise I felt good. There was no fever, no sore throat, nothing in it. Just so I ended up, basically I had 5 days off and I was able to get some stuff done. But I totally advocate for people getting the shots because it definitely, I am sure, eased the symptoms that you would normally get with it. And get vaccinated. It's a big bonus. So and everybody's different, right? So even people that have had 4 shots, I know that they've been sicker than certainly what I was. But they, if you take the precautions, then hopefully you're doing good. But Dr. Chirico, you're right. You isolate and wear a mask afterwards and try to protect other people. So thank you for all the work that you're doing, and we still try to keep that message out there to get your booster.
Well, thank you so much, Jamie, for sharing your experience and your advocacy for getting the vaccines. It's really important because, as I mentioned too, it really has proven to reduce severity of illness. And everybody, I'm sure, here knows more people that have had COVID than have not had COVID. And you're absolutely right. The number of cases are so much higher because there is limited availability for testing that we can, the data represents due to different eligibility for testing for sure. And so while transmission continues, we want to keep the severity as low as possible. And hopefully, people are having a similar experience that you have. So thank you for that, sharing that.
Dr. Chirico, can I ask you one question as well? Because I think I know the answer to this, but since there are people online that may be able to information. But if you go to your pharmacy and they have both the flu shot and the COVID shot available, can you get them both at the same time?
Yes. And I just want to also, now that you mention it, a big shout out to the pharmacists and all the work that they've done to help us with COVID vaccinations, flu vaccinations. Over the last number of years, they've really stepped up to help us because we couldn't do it all alone. And primary care and hospitals doing vaccination of their own staff and patients when asked. And I know it's a lot of work. Similarly, long-term care homes and retirement homes helping out with vaccinations, EMS, all of those community supports have been really tremendous in that. And if Dr. Simbalaty, if you have anything to add to that.
No, I would agree. We wouldn't be able to do this rollout without the pharmacies, especially because they as we're trying to transition into a more routine practice of vaccination rather than the mass immunization clinics. They're going to be a key partner moving forward in terms of providing both the COVID vaccine and then continuing to provide the influenza vaccine. So that's key. And then so helpful that long-term care are really taking the reins in terms of administering vaccine in their own homes, and so that really decreases the burden on us, so that we can continue to provide vaccines for those who don't have access within their own residence. So very helpful. And I just one little caveat to the co-administration, Nancy, with the flu vaccine. It's just for those under 5 that for now we're recommending that there still be a 14-day period between the COVID vaccine and any other vaccine, not because of any particular concern, just because there might be a misattribution of any symptoms, any reaction potentially to COVID vaccine, and we just want to be able to track that accurately.
Thank you. It's all these little things that people ask you in the community, and it's great that we have the opportunity to ask them here, and then that's a question you could direct back to people, your medical practitioners, and that when they do arise. So I really appreciate that.
And if the public have questions, they certainly can go to our website. There's lots of information there, as well as they can give us a call. We still have our call center operationalized, and we can certainly provide them with answers to the questions. If we don't know, we can refer them. Certainly, there are lots of resources available and consultations with the sick kids, if required, for their little ones. Be happy to direct them.
I think that the website's been helpful, even for me to keep up with it, because we find out we have a ghost on there. We find out that when there's changes in policy and that people get a little bit confused.
Sure.
So, and I have to say that the website has been kept really well up to date, so that I feel very confident referring people to your website, and I go there myself to seek clarification.
Yeah, and if there's anything that, suggestions for improvement, we're more than happy to address people's needs. And
it's easy to maneuver, I find it is anyway.
Thank you.
Yeah, so that's helpful. Any other questions of Dr. Churko or Dr. Zimboletti? Okay. Seeing none, we'll go on to the board committee report. We had a meeting we had an earlier meeting in Finance and Property Committee, and we do have a motion coming out of that committee, moved by, I think I want to make sure I got this right, moved by Marianne and seconded by Scott. Whereas the current Ontario Nurses Association collective agreement expired on March 31st, 2022, and whereas negotiations were held with ONA on September 7th, 8th, 14th, and 16th, 2022. Now thereby be it resolved that on the recommendation of the personnel, I jumped to the wrong one. I've got them in the wrong order, I think, that's okay? Okay, so therefore be it resolved that on the recommendation of the Personnel Policy, Labor Employee Relations Committee, that the Board of Health approve the monetary changes to the collective agreement between the North Bay Parry Sound Health Unit and ONA for full-time and part-time employees effective April 1st, 2022 to March 31st, 2025. Any discussion?
Maybe the only comment I'll make, Chair, is that I was referring to them at the committee level as motions and resolutions, but I should have been referring to them as recommendations. That's all.
Right.
Back to you,
Okay,
Chair.
thank you. Thank you very much, Scott. With no, I see there aren't any hands up, or there's no discussion. With that, I'll call the vote. Blair?
Yes.
Gary?
Yes.
Jamie?
Yes.
Scott?
Yes.
Marianne?
Yes.
And with that, the motion is carried. Thank you very much. I'm trying to do a multitask here. I'm signing off stuff. So I'm a little rusty over the summer, I think. All right. Moving on to the Finance Committee. No, we still have another motion. Sorry. I still have another one here from, we still have another motion here, a resolution coming from that committee as well. Right? Yeah. Thank you. So moved by Gary and seconded by Marianne, that whereas the current management non-union employee policy expired on March 31st, 2022, and whereas discussions were held with the MNU, which stands for the Management Non-Union, representatives on August 31st, 2022 and September 12th and 22nd, 2022. Now therefore be resolved that on the recommendation of the Personnel Policy, Labor Employee Relations Committee, that the Board of Health approve the monetary changes to the MNU employment policy between the North Bay Parry Sound District Health Unit for full-time and part-time MNU employees effective April 1st, 2022 to March 31st, 2025. Any discussion? Seeing nor hearing none, I will call the vote. Blair?
Yes.
Gary?
Yes.
Jamie?
Yes.
Scott?
Yes.
Marianne?
yes,
And with that, the motion is carried. Okay. Now, we also have another motion coming. Now, this one would be the one coming from finance. So I took you to the personnel policy ones first, and now I'm taking you back to the finance and property committee. And I apologize for doing them in a kind of a different order. But we have a motion here from Scott, moved by Scott and seconded by Jamie, whereas the lease for the Parry Sound branch office location that has been serving clients since 2006 expires August 31st, 2023. And whereas the existing location is dated and no longer meets the current requirements, including the expansion of dental services. And whereas the search for an alternate location conducted in consultation with real estate firms, community partners, and with input from others resulted in successfully finding a suitable site. And whereas upon approval from the executive team, a Parry Sound's Program and Services Collaborative Working Group was tasked to work on preliminary space design and lease costs for this location to provide programs and services in the community. Therefore, be it resolved that on the recommendation of the Finance and Property Committee, that the Board of Health for North Bay Parry Sound District Health Unit negotiate with the landlord of the proposed facility to finalize the design, construction, and long-term lease of the space for occupancy effective June 1st, 2023. Any discussion on this?
You know, I never asked Paul, I guess, when he was there and we were talking, but the Board of Health has a high profile, meaning it's very visible to a lot of people. I'm just curious, when you say design and construction, would this space have its own air conditioning system?
It's really, I can't answer
Okay, so
that.
no. I just, the other would be, does it have its own air handling system? Meaning, a lot of people go into Shoppers that are sick, and if it's the same air handling system, the air is going to get brought from Shoppers up into the space that we're using. And if there was an issue and it hits the public, I think, would say, do you guys not think about this stuff? It should be separate. It should be handled in its own. And so when our clients go there, they want to know that the air is clean, air conditioning is controlled by our own people on our own floor, our own space. And the same goes for, you know, the elevators and the stairwells and all that kind of stuff. And I'm not trying to be a poo-poo here, but to me, it's really, really important that all those things be considered and taken into account. So if they are designing and constructing, I hope that all of that is taken into consideration. That's my two cents.
I'm sorry, Gary. We have Paul still online, and he's got his hand up. So, Paul, could you please?
Oh, okay, good.
Yeah, no, that's an excellent point. For any construction of any site where we provide services, a whole IPAC assessment is done for the location, and that's also in collaboration with the landlord if it's a situation such as we described and talked about. So that will definitely be done, and it will also consider all the recent new requirements that need to be in place due to COVID. So definitely a good question. And is definitely something that because we're going to be providing services out of there, so we have to meet all those requirements.
Yeah, and if
just
there was
to-
enough space for expansion and, sorry, Dr. Charco, but enough
No,
space for
I-
expansion and the water quality needs to be good because we're putting water in people's mouths that it has to be high quality.
Yeah, just to clarify, IPAC stands for Infection Prevention and Control. So all of those things certainly are considered and for provision of services from the health unit, just as we did for this for the new building construct.
That was a really good
Okay,
question.
no.
Thank you for raising that. And Paul, thank you for staying on to answer it.
Yeah, I was just going to leave, so I'm glad I could answer that, but definitely
Yeah.
top of mind. Thank you.
Good, thanks.
Yes. Thank you. Gary, is that, does that satisfy an answer to your question?
Yeah, no, it does. Just, we don't want to be hung out there and some sort of liability that we didn't do our homework or whatever, but it sounds like everything's under control.
Great. Are there any other, is there any other discussion, questions? Seeing and hearing none, then I'll call the vote. Blair,
Yes.
Gary,
Yes.
Jamie,
Yes.
Scott,
Yes?
Marianne,
yes,
and with that, the motion is carried. Thank you. Okay. Correspondence, there was a list that was in your package. And again, I'd like to highlight what Dr. Chirko said. One of the things that we received, and I received too, is the announcement that Dr. Zimbalati has been appointed the Associate Medical Officer of Health for the North Bay Parry Sound District Health Unit. So congratulations, and she's been such a boon to us during all of this COVID and even before that. So we're really, really happy to have you here.
Thank you, Nancy. I'm happy to be here. Very
All done.
Under new business, we have number 10, 10.1, a list of legal advisors for 2022, which has been revised. And there's a listing in your package of, and Dr. Chirko, I'm just gonna maybe have you say what the change is and speak a little bit about our different.
Thank you,
counsel.
Nancy. The main change is just a change in name in the partnership of Larmer Dicklin has changed to Larmer Jackson. And the lawyers that we list down here are specific to the needs of public health in different areas. We avail ourselves to different firms that have the expertise in the areas that we require legal consultation on. As well, we do have the latitude that if we need some specific legal information and consultation in between, say, board meetings, we can have a new lawyer if we feel that it's appropriate to engage with them for their expertise, and then bring it to the board later for approval. But this is the list that we usually use and have been extremely helpful in moving through legal issues that we encounter.
Thank you. And I know the labor relations legal advisors that we work with Filio and Wakely, Thorpe and Angeletti, are really, really excellent when you're negotiating contracts and have a history with us, which is also a really important thing.
Yeah, and I wish to take the opportunity to publicly thank all the legal expertise that we've had, and including one of our board members, Mr. John D'Agostino, who has been invaluable as a board member in the past for the health unit. So thanks to all of them for helping us navigate through some difficult times.
And we know that the whole world is becoming so more litigious that we really need to watch our P's and Q's and decision-making on touchy issues. And it's impossible to know all of those different areas yourself, and it's important that we have these people to call upon. So be it resolved that the Board of Health for, so we moved by Gary and seconded by Mary Ann. Be it resolved that the Board of Health for North Bay Parry Sound District Health Unit approve the appointment of the following legal advisors. And we have corporate legal advisors who are the Corporation of the City of North Bay, Lucenti Orlando and Ellies, and Frank Williams and Associates. For enforcement legal advisors, we have Joseph B. Kennedy and the Corporation of the City of North Bay. For Health Protection and Promotion Act, HPPA, legal advisors, we have Joseph Kennedy and Middleborough and Stevens and Larmer Jackson. And then for Labor Relations, legal advisors are Filion Wakely Thorpe and Angeletti. And furthermore, be it resolved that the North Bay Parry Sound District Health Unit may use additional legal advisors as directed by the Medical Officer of Health, Executive Officer, and approved by resolution at the next regular Board of Health meeting. We had some discussion. Are there any other things that people would like to ask or any further discussion on this particular motion? Seeing none, I'll call the vote. Blair?
Yes.
Gary?
Yes.
You say yes? I didn't hear you. Yes, Gary?
Yes.
I'm sorry. Jamie?
Yes.
Scott?
Yes.
Mary Ann?
Yes.
With that, the motion is carried. Thank you. We don't have anything for in camera for our number 11. And unless we have anything else that anyone would like to raise, we can have adjournment. So, bye everyone, and we are adjourned at 7:01. I'm a minute over. It got a little faster. Thank you
Thanks,
everyone for
everybody.
being here.
Thank
Good night,
you.
good night, everybody.
Thank
Bye,
you.
everyone.
Take care.
Good night.
Bye.
Bye.
Bye.